Hello, my name is McManus. I'm the Director of Public Health for Hertfordshire, and I'm going to answer a couple of questions that people have asked on the Ask Jim page on County Council sites. First question, does a person have to test negative for coronavirus before they can have the vaccine? No. If you think about it, they don't do this with most other virus vaccinations for viruses like flu or for many other viruses. So there's no need to do it here. And the national vaccination experts say that in common with lots of viral infections, there's no safety concerns about vaccinating people who've had a previous COVID infection, as far as we know. So if you've got a current or a confirmed infection, you might be deferred for up to 28 days to stop you infecting others in the clinic and let your body fight it off. But that won't necessarily stop you having the vaccine in due course. At the same time, if you've got ongoing symptoms from COVID, that's also not a reason not to get vaccinated. But doctors may act on the side of caution if you have really debilitating symptoms for a while after COVID. So the best thing to do is speak to your doctor or nurse when you go to get vaccinated. Question, what percentage of the population do you think will end up being vaccinated, and is there a level at which it is likely that restrictions will be eased? Well, the short answer is we think about between 50 and 70% of the population need to be vaccinated for us to have the kind of population immunity we want. So it's really important everybody gets this, and I will definitely be in the queue for this vaccine when I'm allowed to join it. Whichever version of the vaccine they give me, I don't mind. I've read about them all. I think they're all as safe as one another. And it's important to realise that the reactions that were published in the media yesterday were actually of people who had quite a lot of allergies and they carried adrenaline pens. So that doesn't deter me at all from getting this vaccine. As I said, we need at least 50 to 70% of the population to be vaccinated, and when we reach that point, the circulation of the virus will naturally decline, and on top of that, as it declines, we will be able to progressively remove restrictions. One obstacle is that some communities, for a variety of reasons, are less good at taking up the vaccine. So we really need to work on that. And we need to take people's fears seriously at face value, and actually respond to those. Next question. What does the County Council propose doing to stem the ever-increasing positive results? Simply informing people of the rules appears to be having no effect. Are we heading for tier 3? So at the end of the day, we can put in place lots of actions to help people stay safe. And actually, there's quite a lot of programmes going on. So you'll see on the screen now the Health Protection Board update that tells you just the headlines of the things we're doing. There's over 21 programmes that we're working on. But the single biggest thing that will determine whether our rates rise and whether we keep in restrictions is whether each of us as residents feel we're willing to take the precautions to protect each other. So we have a simple choice. Do the basic things to stop the infection. So that's washing your hands, keeping your distance, staying at home and self-isolating if you've got symptoms or have been told to self-isolate and wear a face covering. You do those, we will smash this virus. You don't do those, the numbers will rise and the likelihood we will continue in restrictions will be higher. So the more we don't take these measures, the longer, regardless of anything we do, we will stay in restrictions. So getting out of this is in the hands of each and every one of us. Question, how does eating food with my pint decrease my chance of catching COVID? Surely the fact the food is prepared by kitchen staff and I'm using their cutlery means I'm exposed to an additional risk rather than just having a drink. Well, of course you're right. In and of itself, just eating food with your pint doesn't decrease your risk of COVID at all. The rationale is about how you can make a restaurant COVID safe compared to how you make a pub safe. So the simple actions in a restaurant of stopping people moving about to and from the bar, table service, keeping people seated at socially distanced tables and reducing the amount of interaction actually can stop as much transmission of the virus. And the cutlery will all have been very carefully cleaned. So given the amount of movement and social interaction in pubs, that really can increase the opportunities for transmission. So the answer here is not, I think, to stop pubs working. I think the scientific challenge is to find a way of keeping pubs open and working safely. Now, I think we could do that. So the thing I would love to do is find a way of enabling our pubs to operate safely, because I'm convinced we can do that. We've made places of worship very safe. We've made restaurants much safer. Retailers are working hard in a number of areas, and some of them are doing really good jobs. So if we can manage to make pubs open safely, let's try it. Let's see how we can do it.